clean side. I didn't have my glasses, so I'm sorry.
She takes it off.
All right, so toss on the trash. And after that, what will I do? Change gloves. So take the gloves, dirty gloves off. Hand hygiene, Purell and up. Don't have to wash your hand. Purell in between gloves. Put the new gloves on. Then what's my next? So that I've done the torque, the gloves. What's the A?
Sample supplies.
Assemble supply. So what do I need to assemble? I'll have my dressing available. Okay. I will not remove it. I'll just have it ready here. Okay. Then this is my cannula. It's a gauge 20.
Do we need a sharpskin header for that?
Yes, we need. All your patients' room should have sharps container. And then I have my gauze. Okay. That I might need, might not. I will have my tape. Do I want to cut this and post it on the? No. You will see that, but don't even follow. All right, this is my J loop. It's called J loop because eventually, as you put this on the patient, this will look like a J. So, but this is technically an extension tubing. Okay. So what I'll do is, this is my saline. It's pre-filled, it's pre-packed, it's clean. I will connect this one here, expel the little bit of air. We don't want any air injected to our patient, so this is assembling equipment. I will flush this line because there's air here, probably, I don't know, less than 0.5 cc of dead space air there, just enough that I have here my flush. All right, that's ready. Am I forgetting anything? All right, so assemble equipment. What's the T again? Tourniquet. We apply our tourniquet. See how I didn't leave that on? Because it took how many minutes to prepare all this with me talking. All right, and then next is I'll enter the vein. Did I touch this area again? No. If in case you end up touching, because, oh, where am I going to insert this? Go ahead and clean that again with alcohol. So then I'll get my cup. Now this, be careful when you pull this out. These are the parts of your catheter. This is your cannula. This is your collection chamber. This is where you see backflow when you're in the vein. And then this is going to be an anchor for you, because that's what you will push as you are advancing the catheter. So what really happens, guys, is as you do this, okay, let me just remove it, okay? Don't do this. All right. This is what's left in the patient. This is used to help thread this cannula. So don't, see that? This is what you are, so you puncture, and then this is what's left. So as you're pulling this out, you're pushing this in. All right, don't even try this at home. Okay, so I will hold this, otherwise this is gonna move. Now there's what you call a bevel. When you say bevel, this catheter is not even. Do you see that slant tip? That's how you hold it, and that's how you insert it. Bevel up. And how many angle will be when I enter the vein? As low as 15 to 30 degrees. So I'll pull my skin, all right? Of course, this is hard skin. And what I will do, I don't have my glasses. Anyone have glasses? I could borrow. I will insert my vein. See how my angle is 15 to 30 degrees. You could do flat, the better. As I advance this, does it hurt?
Very much so.
See that backflow?
Yes.
So you know you're in the vein. Now, you advance how that chamber is. You're advancing this and you're pulling back. Advance, pull. Can you see that? Advance, pull at the back, advance, pull, and then pull all the way until you hear the lock, the click. That's lock. All right. What's my next step? I'm done. So that's solved, right? Stick, advance, tourniquet off, right? Tourniquet off. I'm done. What's my next step? Solve, TDJ. tourniquet off. The next one, T, is apply the gauze. Tegaderm dressing. Do I put the diaper first? Not yet. Am I touching the... No, don't touch this. Remember, you puncture the patient's skin. First line of defense. Just put it just 3/4. Leave a little space there for later. All right, then next is apply my diaper, is my gauze. Why will I have to do this?
In case any blood comes out.
Correct. So, in real life, guys, this should be effective. In real life, if you press at the end here, there's going to be very little blood backing out. But sometimes that might not happen. So you put this so you don't mess up. Remove this. I will hold. Of course, this is pressurized, so I might have blood backing up. Take this off and connect. All right. Screw that in. You flush just 3 cc. Not much, just enough. Okay, I don't have resistance. This is not bulging. I'm in. And then what I do is clamp it here. Disconnect your syringe. I'm done. Take this out. Clean that skin a little with blood. Remove the dressing. Remove the paper backing. Or paper, not paper backing anymore. It's in front. All right, you have to protect that because every time that moves, I will date time initial later, but before that, I want to secure this. That's where my tape comes in. All right, when you secure this, it's nice that you have all the edges of your tape folded, so it's easy. And I don't want to, if I do this too much, see what happens to the catheter? So you don't want that. You might want a little bit leeway. So I will support this more like that. See how I'm bending it and I'm flexing it here? So this doesn't push it down. Fold it there, make it a little nice. If you could do only one, that's good. But if you need more, all right. And that's why it's called the J loop. Now, I want to protect this patient's skin, so I could put this one on top of the other one and just secure it more, or like this. Why is this J loop? This is a saline lock. You're just prepping this IV. If the nurse is ready to hang an IV fluid or give medication, they will use this. Voila. Daytime initial. This tiny stuff here, and I'll put this in the corner. Done. Then what will I do next? Clean my supplies. Throw everything. And of course you will not throw anything in the trash. It's done. All right. Voila. Put the bed down, side rails up, etc., etc. All right. So where is your needle? It's inside. No worry for you to be punctured. Okay? Good? All right. So now, because I did a good job, this IV stayed for 5 days. And now she's ready to go home. We're going to send her home. So once she's going home, I'm going to again go back. I need to remove your IV. What else do I need for the IV removal? I just need my gauze, my alcohol pad, my gloves, and my tape. Or a Band-Aid. But let's not use a Band-Aid. I'll use a tape. Okay, I'll come knock, knock, knock. My name is Grace. I'm your tech. I'm here to pull out your IV. Oh, you're the one who inserted it. Okay, ma'am. All right. So then I have the doctor's order. Put my clean gloves on. First, I'll remove the tape. And while I'm doing that, I'm holding here because that's going to be hard on our patient, right? Yow! Yes. Okay. Should not have used that tape. All right, ma'am. Okay, so sometimes the tape gets too sticky. You might want to use the alcohol swab. But if it's easy to remove that, it's fine too. Okay? So I'm holding. Did I stick it too well? Guys, this is very, how will I say? I will not say cheap because it's Tegaderm, but this is the simplest Tegaderm dressing. Why is it that you could see through it? Why do you think they made it transparent?
Just look at the ad, make sure that
Yes, you need to check for signs of inflammation in there, okay? If that is red and painful and swollen, that will be easy to see that. So I'll make this. I will apply pressure here and pull this out and check the catheter. It's good, it's complete. I don't have an issue. Apply pressure for 1 to 2 minutes. No bleeding. You can get a band-aid to put on or get a new gauze and put a tape on it. Any questions? Violent objection? None.
So
Good
what
job.
about if you miss the vein?
If you miss the vein, some institutions will allow you to try pricking the patient twice. Will the patient let you prick her?
I don't think
That's the
so.
question. All right? So it depends, but maximum 2 attempts, most institutions. And then if not, you have to call maybe another person to do it. The third